Welcome everyone to another insightful episode of What Matters to Her Facebook video series, the ultimate destination for all things related to women's health and pregnancy. And as always, we are joined by the brilliant obstetrician and gynecologist extraordinaire, Dr. Probhodana Ranaweera. So without further ado, let's see what question we have for him today. Doctor, what exactly is a hysterectomy and why is it needed?
Okay, right. So hysterectomy is removal of womb, and now there are many reasons that why we remove a womb. Right. So we can categorize them into two main categories. One is for benign causes, and one is for malignant causes. So benign means they are not cancerous. If there are fibroids, if there are adenomyosis, endometriosis, when there is heavy bleeding which we can't find a cause, and so likewise when the womb is actually making trouble, right? Especially when it comes to pain, bleeding, or interfere with quality of life, then we think of removing the womb. Of course, when there is a cancer, we don't have option, either ovarian or lining of the womb cancers, muscle of the womb cancers, cervical cancers, or any of those things. We remove not only the womb but ovaries and sometimes tubes, and even what we call the adjoining tissues as well. So that is something we don't need to discuss. But when it comes to a benign cause, because when it's not cancer, so we don't sometimes have to remove the womb. So there are the options. So nowadays we resort to hysterectomies as the last resort, and when we are doing the hysterectomy also, now we have several approaches. Depending on the patient to patient, these approaches can be different. So there is laparoscopy, which is we try to take the womb out without actually making a big opening in the abdomen, and that's the preferred choice, because it has a lot of additional benefits, like post-operative reduction in post-operative pain, and there are something called adhesion formation, so all those complications are less. And also now we can do something called vaginal hysterectomies, where we take the womb from down below, from the vagina itself, and now kind of it's becoming a little bit more in vogue kind of thing, because we call natural orifice operations. So we are trying to not create any incisions at all, right? At the moment it's not very popular in Sri Lanka, but it's coming, right? But laparoscopy is very popular now because of there, and then a lot of expertise are also available. And the last one would be the open surgery, which is our classical way of doing hysterectomies. Now, it doesn't mean that all operations can be either done by what we call the natural orifice or laparoscopy, because there are certain instances where both will be contraindicated and not going to be difficult, and it's going to cause much more complications than open surgery, especially if they had several surgeries before and huge wombs and all that. Then we have to resort to open surgeries. So it's not something that we not do. There are instances we go, and also sometimes we start off it as a laparoscopy and then we have to finish it as a open surgery. Same vaginal hysterectomy, but then we can't complete it, then we might have to go for open surgery, especially when there are complications. Nowadays, as I told you earlier, we try to avoid it as much as possible. So we try medicine first. There are different types of medicine available, and then there is what we call the miracle drug, is the levonorgestrel releasing IUCD system, where we put a small gadget inside the womb, and it stops period in about 70% of the women for 5 years, and that has reduced our need for operation by about 80%. So we perform only about 20% of the operation which are needed now because of this medicine that's available, and we encourage people to have it. And of course, no complications which are associated with surgery will be there. The only problem is about 20% of the time it will not work, and then we have to go for surgery. Then we know that we have to do it.